For quality full arch impressions, you need PVS putty, PVS light body wash, and Invisalign impression trays. Only use PVS impression material approved for crown and bridge impressions, and be sure to wear vinyl, nitrile, or powder-free latex gloves. Use equal amounts of putty, set the timer, and mix. Putty is ready when it is uniform in color without swirls. Roll the material into a hot dog shape and load it into the impression tray. Press the putty against the tray, locking it into the perforations. Use your fingers to create a trough and build up the putty at the distal portion of the tray to contain the light wash and capture terminal molars. Place the tip of the light wash against the putty and release material into the tray. Firmly press the tip into the light wash material to prevent bubbles. Dry the patient's teeth, then insert the tray straight and evenly into the mouth, centering the tab to the patient's nose. Be sure you do not rock the tray. Use a timer and follow the recommended setting time. When the recommended amount of time is passed, do a fingernail test on the impression material to make certain it is set, as PVS setting times can vary. After confirming that the material has set, remove the impression tray. Inspect the impression for defects. Once the impression has passed inspection, repeat the procedure for the opposing arch. The doctor should do the final inspection. Disinfect the impressions and place them in an Invisalign submission box for shipping. To get the best results, use the impression technique that you are most comfortable with. If there are deep undercuts, block them with wax before taking impressions. For patients with extreme gag reflex, sit the patient in a more upright position to help avoid gagging. When inspecting impressions, look for defects such as air bubbles, double impression, missing anatomy, push-through, blended tooth and gingiva. Retake any impressions that contain these defects.